The first three words of the VNA mission are the VNA Cares. That's the most important thing anybody needs to know about our organization. We have lived that mission for over 100 years. Our board, our staff, and our large core of community volunteers live that mission every day because the VNA cares. One of the things that we know about healthcare now is that change is the constant. Our staff really need to stay at the leading edge of all of the healthcare technology, the use of equipment, and the new practices to meet our patients' needs. They're able to do this by using a high-touch style of care while still meeting the high-tech needs of our patients. We're so proud to be our community's full-service home health and hospice organization. We provide services to over 5,000 individuals and families throughout our counties, regardless of their ability to pay for the services that they receive. That's because the VNA cares.
I've wanted to be a nurse since I was a little girl. It's just something that was within me. I feel that in the home care setting, we have a special opportunity to promote healing in a very caring way. And I think our patients benefit from that. We get the opportunity to spend longer periods of time with patients in the home. And of course, we're seeing them on their own turf. And we really are a guest in their home. So we have to work at establishing a trusting relationship with the patient and with the family members. They often are uneasy if they've never had VNA services before to have us come into their home. So we have to ease in gradually, let them feel comfortable with us, work at developing that trusting relationship. I can't think of any other work I would rather do than being a visiting nurse. It's a very, very rewarding field to work in, and I go home every day feeling I've made a difference in someone's life.
After spending approximately 8 months in the hospital and the rehab center, I was prepared to come home. Both my wife and I were fearful about me coming home because having had 8 months of 24-hour care by nurses and caretakers at the hospital, we wondered how she could possibly take care of me.
The night before Marcel was coming home, we were offered the VNA services, and we did not know how extended that service would be. We've had the VNA in here like 3 days a week, 5 days a week, 7 days a week, and now nights.
As we used the VNA more and more, I became more and more independent and was able to do more on my own, which made me feel a lot better.
I used to be a piano teacher. That was my life. I'd been an organist and a piano teacher and accompanist. They told me I'd never play again. I had a physical therapist, and she decided that if I should go back to my very beginning books, and where you just do, 5, 3, 1, way, way back, and I did that. That was my biggest accomplishment. I worked for it, but I got it, and so I'm not ready to play for church yet, but
Dad was the primary caregiver for Mother. 24 hours a day, and for quite a few years after she became quite crippled. And so for almost 3 years, the VNA visiting nurses came 3 times a week. He could just relax for a while because they were taking up the burden. And when they were able to get Mother to smile and even joke sometimes, that was probably the brightest thing that could happen in Dad's day.
My husband had a recurrence of pancreatic cancer. He died at the respite house, and it was a wonderful place and a wonderful experience of both joy and sorrow at the same time. What I discovered was that the respite house was as much for me and my children as it was for him. What we needed was caring and support and hope, in a way, of seeing that life goes on. And I got that there.
I work in the maternal child health department of the VNA, and I personally work more with families that have a lot of high risk factors: substance abuse, homelessness, teenage moms. One mom that I remember particularly is one who still is in touch with me, even though her son is starting high school next year.
We have remained friends over the years. She has meant so much to me, and I think that Andrew is the way he is, and I'm the way I am because of her and the changes she's helped me make in my life.
I was able to help her get into counseling, which really helped change her life, and to this day she still credits those 6 years as really important.
If she hadn't been there, I think the path could have been a lot different, and things could be a lot less positive than what they are now. And I'm really proud to know her.
Our work makes a tangible difference in the lives of the people we serve. The VNA will continue to adapt to all of the new and successful advances in healthcare while we provide the most compassionate and effective care to our patients. In doing so, we honor our past while we embrace the future.